Hi, everyone, and welcome to our practitioner call. Today is Thursday, it's 9 a.m. Pacific. This call was designed by practitioners for practitioners and anyone else that would like to learn. So we have a lot of practitioners on the call, and we have a lot of clients of practitioners on the call. And this call is always a little more broad, because practitioners need to know the different tools in the LifeWave toolbox to help their clients. This call was created by Doreen. Doreen is a hair analysis expert, and she has many folks that do hair analysis on this call. And because Hannah introduced this to her about 1.5 years ago, she really saw it work. And she shared it with all of her clients and all of her practitioner friends. That's how this call started. From there, we have Dr. Patty, who's an MD on our call now. Dr. Mark Gordon comes on this call much. He's an MD. We have massage therapists. We have craniosacral therapists. We have therapists on this call that do Feldenkrais. We have therapists, acupuncturists. So there's a lot of different practitioners on this call because they like to have a little bit more information about how the different products work. Dr. Patty asked me about 2 weeks ago if at the last 10 minutes of the call, we could talk about the tools for practitioners, the tools that they could use to set up their offices so that they could actually get the patches to their clients. The good news is we are creating those tools as Dr. Patty has asked, and they now are on Start X39 Biz. That's startx39biz.com. and is under input order. I will show that at the end of the call, but we have the new practitioner order form. Thank you, Wendy, if you're on the call. She's created the new practitioner intake form. And of course, we have also a client welcome letter to give your clients information about what they've just ordered. We'll show you that today. And then Jan, we've ordered 5,000 what we call gifting envelopes, or I like to say they are brochure envelopes where they are, you can sell patches out of them, you can give patches, but on the outside of the envelope is like a brochure. It explains how the X39 works. So we call that our gifting envelope brochure, or our practitioner envelope brochure for the office. And so we have 5,000 of those ordered. We have 10 practitioners that have already asked for their office setups, which will be the practitioner order form. Now, Janet, will be the practitioner intake form. Thank you, Wendy. And it will also be the welcome letter. You can make a copy of that. And each practitioner will get envelopes and 2 point of sale material for their front desk that you can then put in plastic 8x11 plastic shields that you can get online or at Staples. So that's what Jan is working on. She hasn't mailed those out to you practitioners because we're waiting on the 5,000 envelopes. But Jan, in chat, if you could put your name and email in chat so practitioners can get a hold of you. As I said, I will right now fund small setups for the practitioner offices so you can get that going. And Dr. Patty, thank you so much for your great idea 2 weeks ago to get something ready to go for practitioners. I think it was such a great idea. And whatever you say, we do. Isn't that great? So
no, thank you so much. It's great. Thank you.
No, thank you for telling us what practitioners need. So with that, let's go ahead and start with the X39. This is the stem cell activation patch, and we'll just talk a little bit about what they do. And then from the X39, we'll have Dr. Patty talk a little bit about why she's using them in her clinic, and also what's been happening to her. And then we'll do some roundtable about X39. And as we do roundtable and practitioners talk about some of the other patches they're using, I'll come back and talk about the science. So we kind of do a practitioner roundtable, which is a little different than other calls. So let's get started. So it all started with the X39, the stem cell activation patch. For me, it was 3 years ago, and it was a practitioner that shared this with me. Dr. Rhonda Donahue is a PhD in nutrition, and she owns 2 clinics, one in Costa Mesa and one in the Palm Desert. And we've been friends for a decade. if you know Dr. Rhonda Donahue, she is very particular about her ingredients in supplements. She will only do organic and only activating type ingredients. And so whenever I was looking for protocols, I would go to Rhonda and I would say, what do you think of this protocol? What do you think of this supplement? What do you think of this ingredient deck? That is what Dr. Rhonda Donahue does. And she's been doing this for 20 years. So when I was diagnosed with breast cancer in 2017, I did a ton of chemo, radiation, double mastectomy. And you need to admit in, Jan, please, I won't say it again. Just to find after all of that treatment, 6 months later, a piece of the breast cancer was hiding under the organic expander of the double mastectomy, and it just popped out of my skin, technically stage 4 breast cancer in the lymph of my skin. Super duper depressed at that point. And that's when Dr. Rhonda knocked on my door and said, I found something, I want you to wear them. They're X39 stem cell activation patches. And she gave me 10 and they look like this. And I laughed. I said, they look like Band-Aids. And she says, there's so much more. They're a form of wearable light technology. Technically, they are photobiomodulation, which means that these patches are non-transdermal. They actually go on your skin. And because your skin is a low-grade infrared light, they reflect back your own light to make things happen in your body, hence photobiomodulation for you doctors. Inside this patch is white organic material. This organic material is actually organic crystals made out of amino acids, sugar, and water. And when you put it on the skin, doctor says, that's how it works. And it reflects back a light wave to elevate a peptide in your body called GHK copper peptide. Write this down if you're new to the call. Startx39.com. That website has a link on it that says GHK copper peptide. Click on it. For you doctors, you will love to see that GHK copper peptide is the holy grail of anti-aging. It does a lot. One of the things it does is it activates your own stem cells again. It acts like a telephone to your stem cell factory. It basically tells that old shut down factory to start working again. And here's the thing, our factory shut down halfway, like 50%, this is good, 50% production by the time you were 30. By the time you're 60, the factory's completely almost shut down. All those stem cells went dormant, but the factory is still there. It just needs to be turned on again. Guess what does? The X39 stem cell activation patch gets the factory turned on again. And all of a sudden, your stem cells start producing again. You make more of them. You reset them to a younger, healthier state. This is everything that Dr. Rhonda Donahue told me. But I'm not a practitioner. I'm just a girl. So I said to her, well, that's really interesting. I'm so happy that my stem cells are reactivating, but I don't 100% know why that's good. And she said this, stem cells are the only cells in your body that are changeable. They can change into whatever cells your body needs for repair, like when you were 20. I said, oh, that makes sense. She goes, did you have gray hair when you were 20? I said, no. She goes, did you have wrinkles when you were 20? I said, no. I did say I had the big the unibrow. Remember that? Anybody have that? It's so big that it went all the way across your eyebrow. That was me. That's when I was 20. I had a lot of eyebrow. And she goes, yeah, you might not get that again. I said, okay. And then she said, did you have cancer when you were 20? And I said, I did not. And she goes, that's because your stem cells were working. What if we could activate that army to start again? I don't know what your body needs first, but your body knows. I do know I can activate your stem cell army and it will march and it will fix the first thing you need to live first. And then it will march and fix the next thing and the next thing and the next thing and the next thing. And so I said, okay, I'll put it on. And so I did. And I put it right below the back of my neck. You can also put it underneath your belly button. but really any spot will do. Your whole body's light. There's only one rule, she said, 12 hours on to activate and repair and 12 hours off. Let me say that again. 12 hours on to activate and repair and 12 hours off. Because our body's light, and this is a signal, it's non-transdermal. They're not putting stem cells in you with this patch. They're activating your own with light. And if you wear it 24 hours at a time, over and over and over again, your body gets used to the light and it doesn't work so well. So once again, 12 hours on to activate and repair and 12 hours off. So I did. Well, the first 2 days, I had the taste of chemo metal coming out of my mouth. For you doctors, you probably know this. They must put a ton of chemo or a ton of metal in chemo because the taste of it came out of my mouth. Day 5, I noticed my skin was so soft. And by day 10, I just felt like living again. All the PTSD that I was dying went away. I don't know what's going to happen to me. I still don't really know the whole cancer thing, but I know I feel good. And so I called doctor up and I said, doctor, I don't know what you gave to me, but I want to share this. And so we've been sharing these patches ever since. And today we've helped over 35,000 families feel better. And I'll tell you, I don't know if any of you were on the call last Thursday night when we had the lovely women that had chronic pain, like pain for 10 or 20 years. But when one of the women basically hadn't been able to get out of bed for 12 years and she got out of bed and vacuumed, it made me cry. When another woman has been in so much pain that she couldn't plan a trip with her family or even go to the movies for 2 hours, was planning her first trip in 10 years, and she went to her first movie, it made me cry. And it made me realize that we are here and we have great purpose. So with that, put that X39 on yourself, see what it does. And if you are a practitioner and have clients, put it on your clients, because the cost of X39, a whole sleeve, is less than a cup of coffee a day to wear one patch. Less than a cup of coffee a day is basically, anywhere from 100 to 150 bucks. I mean, and we'll get more into pricing at the end, but it is really, really a reasonable treatment. If you look at actual stem cells injections, I mean, you don't 100% know what you're getting. It's not your own DNA, and it could be anywhere from $5,000 to $10,000 a shot. Or you could activate your own for $100 a month. It's pretty cool. So that is X39. Once again, for you practitioners, I know you're going to want to see the science. So go to startx39.com under patents and research and click the patent and research tab. You will see that we have a patent that says, yes, X39 activates GHK copper peptide in the blood, which stimulates your stem cells. We have a 20-year patent. It's right there. You will also see over 100 research articles on X39 and all of our other patents. And so David Schmidt, our owner, inventor, and CEO, has had this company since 2005. And it is this beautiful combination of light technology, photobiomodulation, and activating different things in your body. X39, or your stem cell activation, is one of about 15 patches that he makes. He started with the energy patch in 2005 because the Navy SEALs wanted to keep their guys up at night without stimulants. The company was doing about 30 million a year until 2018. And I think that was an interesting time when red light sauna came in, lasers came in, practitioners started seeing that light was a true modality. And this was a wearable light alternative, or a new way of using light where you could wear it. And stem cells, everybody wanted to understand that better. So our company went from 30 million to, in 2018, we have just hit over 300 million a year. So know that there's some really cool things happening. Our company's vertically integrated, which means David is kind of a a cross between Tesla and Iron Man, if that makes any sense. So he makes all the crystals in his own lab, right? He's vertically integrated, and we're in 81 countries. And we have a distribution facility in San Diego and in Ireland. So we ship all over the world, which is pretty exciting. So with that, Dr. Patty, could you unmute yourself and just tell us a little bit about how you found the X39 and what's been going on with you, your clinic, and why you are sharing this even? And what kind of doctor are you, Dr. Patty?
Sure. Well, it's good to get to meet everybody. I'm a functional medicine doctor. Basically, I do integrative medicine, holistic medicine, a lot of terms for it. I started out in internal medicine and had always done a lot of just study on my own that you don't learn in medical school about holistic medicine and preventive medicine. And so that is something that has always been very near to my heart. So when I heard about the patches from one of my patients who was doing very well as a result of using them, I sort of perked up and I thought, wow, I haven't heard about this, but I love the idea of stem cells because I was actually using stem cells in my clinic. And at that time, the FDA has since removed that ability, mostly, not completely, but mostly from us. But it's very expensive, and I think it's safe and effective, but it's expensive. And so when I heard about the patches, I thought this is great because it will allow the patient to have more access to something even in a much more natural way. And so I was excited about that. And then I heard that the part of the X39 was the whole thing about stimulating the GHK peptide pathway. And so I also was using that particular injectable peptide along with some others and still do a little bit of that. But I've mostly transitioned to the patches because most patients don't really want to inject themselves with a peptide if they could use a patch. It's much easier and it's about a third as expensive. And so it's been a great thing, I think, for my office. But before I started moving it to my clinic patients, if I can, I always try to vet everything that I, prescribe for my patients. And so I thought, well, I have one patient that says this really works. I'm going to try it. My husband is always my guinea pig too, and some of my family members. So we began using it, and I just love it. I have multiple sclerosis, the symptoms of multiple sclerosis, and I am always looking for things to help with those symptoms. And one of them is I have a lot of pain, in particular at night, and it causes me not to sleep very well. So, and I'm not going to take pain medicine, and I'm not going to take sleeping pills and all those things because I know there's so many bad side effects and addictions that can happen. So I've just sort of been dealing with it. And ultimately, everything I would try in the functional medicine world honestly didn't really help. So when I first tried the patches, the first night I used the ice wave patches, I did it for the whole body. And I had I would say about a 50% reduction the first night I used them on that pain. It was incredible. And I thought, well, sometimes this happens to me. The first time or two it works, and then after that it stops. Well, but I continued to move the other two patches. I put two on the bottom of my feet, and then I moved the others up. And I'm sorry if you can hear this. Let me see if I can put my headphones in.
We hear you fine, Dr. Patty. You sound good.
All right, you're not hearing that weed eater outside.
It's not bad at all. You're good.
That'll be a little better. And so they're right at my window. Sorry about that. But anyway, and so I moved the patches up. I tried them. There are different places you try them. And the second night I did it, it was about 50%. Third night I did it, I moved it up. And Marci, you had mentioned putting it, I believe it was you putting it on you could try it on your shoulders. And so I did. I had two on my feet, two on my shoulders, and it reduced my pain about 80% the third night. And and since then, I have had maybe a couple of nights that it's been more like back down to 50, but I've sort of attributed that to other things. It is amazing. And of course, helps me sleep. I'm taking the X39
and 49 in the day. And then I alternate some of the other patches like glutathione and carnosine and the SP6. Those are the other ones I've done, and I don't do those every day. And I've done the energy patch as well. So that's occasional. But then at night, I do Eon, and I do Alavida, and I do my Ice Wave. And I sleep better than I've ever slept, and the pain is so much better. I find that if I miss a night using the Ice Wave, that the second night I'm still okay, but by that day, I'm starting to feel that pain again. So it lasts about 18 hours, but no, about 36 hours, but I just am doing it now every night. Why not? So anyway, yeah, it's been great.
Can you tell us a little bit, Doctor? I have lots of questions for you now. So I want to know, first of all, the GHK copper peptide. You said that you did injectables of GHK copper peptide, but you've moved them to the wearable X39, which elevates GHK copper peptide. Why is GHK copper peptide important to elevate, in your opinion, Doctor?
Well, so it seems to be something that specifically helps with a number of different areas, like what we talk about with the X39 patch. It helps patients sleep. It, in particular, is very good for restoring when patients have injuries, like an elbow injury or a shoulder. You can see I've got my patch on here, right here. It seems to restore actually tissue, cartilage, reduce inflammation. And so I have patients, and I was having them if they had, like, let's say an elbow situation. My brother-in-law had an elbow situation, and he was injecting right into his elbow. And it's just under the skin. So it's a little tiny insulin syringe you use, but you do it every day for 30 days. And then you cycle those peptides, but you take 30, 60, 90 days off, and then you can reuse them. GHK copper is something that we make, and the GHK, the copper, actually is what helps to bring the GHK out a little bit more actively. But it's something our body makes naturally, but when we're sick, we're stressed as we get older, and we just don't make as much of it in this toxic world as we need to be more efficient for our body overall to feel better. So I had not heard of AHK copper, and that's not out there. And so I thought, oh, that's very interesting. We'll try that too.
Wow. So what I think is so interesting, Doctor, is that you were doing GHK copper peptide injectables when your patient came in and said, we have a product that will do it through light. And as an MD, sometimes we think, wow, like maybe it would be, kind of far to say this could work too, but you were so open to look at it. What made you so open, Doctor?
Well, the patient that I have that I was working with just has so many problems, and definitely was thanking me for some of the things we had done. But I said, I'm not sure all those things are doing that. And then she was telling me about the patch that her OB had given her. And so OB-GYN. And so I thought I need to pay attention to it. And I began to look at it because of the copper, GHK copper in the stem cells. I began to look at it more because I needed alternatives for my patients. And for me, I'm super sensitive to anything. I can just look at a pickle and be sick, basically. I don't eat pickles actually. But anyway, I don't know why I said that. But I can just feel so sensitive all the time. And that's why I understand my sensitive patients. And I thought this is so good because we're not using any medication. We're just using the natural healing of our body. And I love that, so that everybody can use this. And I don't have to worry about side effects. And I like that for all of us.
Wow. So thank you, Doctor. Yeah. I'm just keeping you with me because this is special today. We got a special, we're special today. So Doctor talked about Ice Wave. Remember, she also has symptoms of MS. And so she has pain. And so if it's okay, I'm just going to show you what she was talking about. Ice Wave is another patch. It's all his patches are photobiomodulation, which means phototherapy, light making changes. Ice Ice Wave takes pain away. And doctor was talking about how she has a lot of pain. And so what Ice Wave does is you put the brown patch on your pain spot and the white patch about 3 inches away, and it breaks the connection of pain. David, the owner of our company, says pain's in the connective tissue. So Dr. Patty was breaking the connection of pain. And what I think is interesting is she wore 2 sets. One she wore under the feet. I believe it's white on the underneath the right foot and brown underneath the left foot. And that helps, according to David, if you go to the website under Ice Wave and look at usage, there's information that says when you wear it under the feet, it helps with full body pain. So that would make sense because my guest Patty probably has a lot of that. But then she took another set and she put it on her shoulder, like I think right here, right, Patty?
Actually, right here was where I've done it. I can try it back there too, but I haven't.
You know, here's the great thing. Doctor knows that our whole body's light, so any spot will work or do. So what's interesting is the 2 Ice Waves really helped her with pain. She also talked, let me see if I can show all the patches that she talked about. And doctor, please chime in if there's something I'm missing. She talked about wearing, I believe, Eon to bed at night. And Eon looks like this. And Eon, I like to say, is the gentle giant. It activates a peptide in your liver that reduces inflammation. It's also the patch that helps you go into rest and digest. So honestly, Dr. Patty, I could totally see why you would wear this one at night. Is this the one you wore at night?
Yes, I do. I wear it every night.
Every night with your Ice Wave. So you wear Ice Wave and Eon at night. Is that correct?
Yes, and also Alavida.
Oh, I don't have Alavida with me. I'm out. Does anybody have an Alavida? Jan, could you put an Alavida up and unmute yourself and let people know it's Alavida? You have to unmute yourself so people can see it on the Zoom. Can you say it's Alavida so people can see it?
This is Alavida and the packaging is like a really pretty turquoise. Can you see
Great.
it?
Yep. So Alavida, you wear right between your eyebrows on what we call the pineal gland. And Alavida is super good at reducing something called oxidative stress. And we'll have doctor talk about that in a minute, but oxidative stress is like all the free radical damage in your body. Like by making your body work like a car, you're gonna throw up, that's not a good word, but you're gonna cause all the toxins or like the exhaust, so to speak, in your body. And Alavida reduces that. In fact, David's done some studies that show that when you wear Alavida, in 5 minutes, your energy turns into a bright turquoise, hence why the color of the package is turquoise. I have found that Alavida helps build collagen and also brings a really healthy glow to the skin. And for all of us that are 55 and over, do you see turkey necks with us? No. Doctor, why do you like Alavida at night?
So I've been using the patches now for about 2 months, and I've been using Alavida probably for 1 month. And Alavida, to me, we say it may even be the second most powerful patch next to X39. Because it has such an amazing antioxidant effect, meaning that it helps your body to bind to what we call any kind of a toxin or a free radical. Your body makes something that can bind to that and then pull it out of your body. And as we get older, but it's not just as we get older, it's as we get sicker. I treat patients that are in their 20s and 30s that have some of these same issues. Living in toxic environments, especially in cities, and everyone's under so much stress and anxiety. It seems like it makes such a difference to be able to have more help for your body as sort of a natural detox and a natural anti-inflammatory as well. And so I just think it's amazing. It helps with organ, it helps with sleep. And when I saw that, I thought, okay, I'm going to use it at night, although I'm sure day would be fine. And I've been using the cream. In fact, I was talking to one of my good friends yesterday about it. And she says, now, Patty, you've been selling something else. We've been selling an NAD cream product that I've loved. And she says, why are you using this now? And so I began to tell her about it comes, and we get from the inside out and then the outside in with the cream. So the patch works on the inside to help with everything, including skin. And, but that's one of the minor things in my mind, really, but it's supposed to be the skin patch. And then we can use the cream from the outside in. And I love the way I was telling her, I said, when I put it on, I look at myself and I think, oh, my skin just looks so much better. And then I said, and then later in the day, I look at myself and I think, oh, I need to go use some more of that. But I love it. I really do. And I'm looking forward to giving it some time and see what it can do. So,
wow. And doctor, that's a big deal, because NAD is an NAD cream is a form of, I would say, an antioxidant cream too. So that you are preferring Alavida over your NAD cream really speaks, it speaks volumes to me. And I would tell you the cream has 3 things in it, doctor, and you probably know this, but this is probably why you love it so much. It's made with algae oil, which David says is the same oil that our skin is made out of. So it absorbs beautifully. It has fat soluble vitamin C in it, which is super good for collagen production and, antioxidant support. And it also has milk peptide protein in it. And those 3 things together, David says, helps, and I have a hard time pronouncing this, doctor, so help me, helps build or helps with creating hyaluronic acid. Can you pronounce that? And which increases your, say it one more time.
Hyaluronic acid. Yes.
And that builds collagen. So that's cool, right?
It is. And I will say, I started using it and I've been using it maybe about 3 or 4 days. And I was a little concerned. I had a story in my head because I've tried some before that different, products that have vitamin C in them. And I started feeling like my face was itching just a little bit. And I thought, oh no, I'm not going to be able to use this. And so I reached out to Karen, who's my nice rock and support. And she said, why don't you stop it for a couple of days? And I said, I just hope I'm not going to be having a problem with this. So I did. I stopped it for a couple of days. I restarted it and I haven't had any problem since. So I encourage anybody, if you do think you may have an issue like I did, like I said, I'm just like the most super sensitive person walking the earth, don't give up, because what I know about these products is that they're so safe. And I love that. And then we want to see, are they effective? And for me, they have been incredibly effective as well.
And, Dr. Patty, I know you've done this to learn about our products. Obviously, you are a wealth of information, but you can do what Dr. Patty does and look at all the videos on all of the products that David Schmidt makes. You go to youtube.com/ or search LifeWave Health. And then you can search David Schmidt and X39, David Schmidt and Alavida, David Schmidt and IceWave. Did you know that he makes 1-hour videos on every product that LifeWave makes, and is right on YouTube? And once again, he is like a combination of Tesla and Iron Man. You will love them. So, Dr. Patty, let's talk a little bit about X49. Now that you've been wearing this, what's your thought on this and the AHK, which is the daughter peptide of the GHK, and also in the line of the stem cell activation patches?
Yes, so I've been using X39 probably for about a month as well. Maybe I did that a little, I think I did that a little bit before the Alavida, so probably more like 6 weeks. And I like introducing them a little bit at a time so you can sort of see. I did just add that to the X39 and what I was doing. I was interested in that because the A stands for one of our amino acids, alanine. The GHK, that's glycine. And so it's just one amino acid chain. So what GHK copper being a peptide, what a peptide just means is it's just a very short chain of more than one amino acid. So that's something very natural in the body, right? And so I mean, many of us can think about like insulin. Insulin is a peptide, and we know it's very effective. We always hope we don't ever have to use it. But that's an old-fashioned sort of peptide, but a short chain amino acid, alanine. And so I thought, I wonder what that can do a little bit differently. But it seems that it's very helpful for fat burning. And I have a lot of patients that really are doing everything they can do, but they're just not quite burning that fat. So I like that idea. I like that it's supposed to enhance performance, but in particular, it works on the soft tissue and helps in that area to also decrease inflammation, which also will help with pain. So I think that it's very good. And I think that any way we can stimulate our stem cells in our body to work better and to be more effective is great.
Wow, thank you. You know, we all talk about stimulating GHK copper peptide and AHK copper peptide, but I have to say, none of us really understand what a peptide is. So isn't it nice to have a doctor educate us? Hey, a peptide is a small chain amino acid, and it's natural and really good for your body. So, doctor, I hope you come more to this call.
Thank you. It's been
you're
great.
teaching us so much. Okay, how about this then? Why not? Tell us about glutathione. Why do you wear that? And why do we need it?
So glutathione is just the major detoxer, that and NAD. Those two together, I think, are super important. Glutathione, I've never, ever been able to take glutathione because it makes my symptoms worse. So I've tried it in all different forms. And when I saw there was a glutathione patch, at first I thought it had glutathione in it. And then as I began to study, I feel like I've gone back to school. I've had to learn so much from all of you and everybody. It's just been great. And so then I realized, oh, it's going to stimulate my pathway. And I do genomics testing, and I know I've done it on myself, and I know that my glutathione pathways don't work well. And I've always been very frustrated that I can't take glutathione to help that, because that's master detox, and we've got to have that in our bodies. And so when I started the patch, I did what Marci, what you said, and any of the other things, and Karen, and any of the other videos I watched, to introduce it more slowly. And so that's what I do. And so I have the glutathione patch. I started out doing just like you said, just like that, where you peel off part of it. I used it for maybe an hour or two the first day. And then I now use it 3 times a week. And I use it, it depends, but usually I use the whole patch for maybe about 6 hours, and I'm still extending my time. But if I start feeling a bit of a headache, or maybe I haven't hydrated quite as well that day, I'll either drink water or I take it off. And so I've been able to use it slowly but surely, and I'm thrilled.
You know, I like to say that where X39 is the workhorse of the line, Eon, we all know, is the gentle giant of the line, like the lavender, the rest and digest. It's powerful but gentle. Glutathione takes no prisoners. This one is going to detoxify you and build your antioxidants. And so, as Doctor's saying, you can titrate it up. The way you titrate it up is you just wear half a patch. And what's great is the sticky. You can just unstick half and wear, sorry, I broke my hand, so I'm doing my best, and wear half the patch and titrate it up. So Doctor wore it for 2 hours, and then she wore the other half of the patch the next day for 2 hours. Now she's all the way up to a full patch for 6 hours. And so just make sure with these patches that you unstick them. You never cut them. If you cut into the crystal, they will not work. So just understand how that works. And know, as doctor was saying, glutathione is the polar outer of all yuck, toxins, mold, fungus, virus, metals, Roundup, pesticides. And doctor, I would say, and you would probably agree, in the last 20 years, our environment, even if we're eating all organic, is just dirty. And we must have glutathione to protect ourselves. Your thoughts on that?
No, I completely agree. And Karen was telling me that she always takes it with her if she's traveling or thinks, she needs to really give her immune system a little greater boost. And in the functional medicine community, we do the vitamin IVs and often do a glutathione push at the end. But again, as you've said, Marci, so aptly, glutathione doesn't last in the body very long. And I've had patients that have reactions to that. They get nauseated. One of my patients actually broke out in a rash. And I really do think it was caused from that glutathione push. So again, that's strong and it's glutathione itself. And so I think anytime we can do something that is a little softer and more gentle, but works, is the best way to go. So I love what Karen was saying about how she uses it too.
Wow. What, doctor, I have I talked about all your favorite patches? Have I missed one that you wear that I should bring out? Do you wear Silent Night or Nirvana?
So I was using Nirvana. I'm not using it anymore, but I may go back to it. And I haven't done Silent Night. That was going to be my first patch, but I haven't needed it. So I may go back to that. I love the idea, or go to it. I love the idea that it stimulates the melatonin pathway in the body. Melatonin, again, is something that works the opposite for me normally. It keys me up, and I've never been able to use it. So I keep saying I'm going to try it just to see what it does, but I haven't yet. But I will do that. I'll report on it.
What about SP6? Tell us about SP6.
I do. I use that. I have a lot of patients that have cravings for foods, and that's what attracted it to me, because I'm one of those. I crave sugar, and I thought I'd like to try that. But it also tonifies your organs. It does quite a bit more for the body, and it helps to balance hormones. And I thought, boy, every woman needs that. So I use SP6 3 days a week, and I didn't have to build up to it. I just don't use it every day, but I use it 3 days a week. And I think that that's a great patch for everybody, but especially for women and anybody that has cravings or, appetite. It might be a good pair to go with X49 as well.
Wow, that's wonderful to let us know about that SP6. I think I need to start wearing that because I have sugar cravings and I would love my hormones to work better. So that's great. Nirvana, doctor, has worn, and I know she's thinking about wearing it again. Just quickly, this patch increases the endorphins. I like to say it's the happy patch. And what was interesting is that some of, if you were on the call last Thursday night when we had our friends that have a lot of chronic pain, they've been wearing Nirvana to help bliss the pain out from the brain. And they wear this patch, and they take the 2-pill supplement, which is a seaweed supplement that holds toxins. And some of the research that David has done, which you can look on YouTube and hear his video on Nirvana, and you can also look at some of the research articles, say it takes about 3 weeks. You got to be consistent on it for 3 weeks, and it can help take the pain away. It can work. Endorphins can be as strong as some of those pain meds, but not hurt you. And so a lot of our friends that have pain are doing a combination of either Nirvana during the day, Ice Wave at night, or Ice Wave during the day and Nirvana at night to give them 24-hour pain control, doctor. What's your thought of that?
No, I think it's good. And I used it for probably a good month, but then I think is when I started with Alavida, and I wanted that one more. And honestly, it was like, I already had this spot taken with Nirvana. And so I thought, well, I think I'll just try something a little different, because but I have referred a number of my patients to that patch. And I'm hopeful that it will be helpful for mood and just helping them to feel better. So yeah, I think that's great. And certainly if it can help with pain, that makes sense. Yeah, for sure.
Yeah, and I would say I talked about it on pain, but you brought up a good point. Your clients or patients that have mood issues,
Mhm.
endorphins make you happy.
Yes.
Who
right.
doesn't want a little happiness in the world? Yes, doctor?
Yes, right. That's for sure. We all need that. That's for
Yes.
sure.
So I am going to take the next few minutes to explain how you can get the patches and the cost. But before I do that, doctor, do you have anything else that you would like to add? And thank you. I did not prepare, doctor. I just said, are you here? And so thank you.
Well, thank you guys too. I've been on the calls. I think I've missed 1 or 2 calls since over this past 2 months, but I've been on them because you guys are so helpful and you've helped me and shared things. And I really respect all practitioners in all fields because we're all doing it together. So thank all of you. I appreciate you greatly.
Oh, thank you so much for your kind words. So let's talk about how you can get these patches. So if you are a practitioner, you can buy them for yourself and you can also get them for your clinic. If you are a client of a practitioner and you want them for yourself, you can also buy them for yourself. And this is the X39. It's a 30-day supply. And you can get this retail for $149. You would just get with the person who brought you here or your practitioner and say, I'd like to ship that. And the company LifeWave ships this to your house like Amazon. So it just ships to you. And a 1-month supply, once again, is $149. Or you can ship this every month for $119. And that's also a monthly auto ship. So it goes every month. So you get a discount if you ship every month. My favorite and what most people get is the silver kit for $299 because you can make different protocols with the kit for yourself, or if you are a doctor, you can set protocols for your patients that make sense for them. So let me explain a few of the protocols so you understand. So doctor was talking about pain and repair for herself, a protocol that she uses for herself. That would be X39, X49, Eon, and IceWave. And that is $299. And then you would do one X39 the following month to keep your stem cells activating. That protocol actually has a retail value of over $400. But you get it for $299, which really gets your sleeves down to $74 a sleeve. And then you get a 30-day money-back guarantee. So there's no risk. I like to say Dr. Thompson from Alaska says this: you need to give X39 a 3-month try. After that, I dare you to quit, because that's how long it takes for it to really work in the system. So that was pretty interesting. Another protocol that works well would be the detox protocol. And doctor talked about that. That would be X39, X49, Eon, and Glutathione, $299. And then you could do an X39 the following month to keep your stem cells activating. Once again, that ships to your house. LifeWave ships it to your house like Amazon. And then you just get the kit and then you just do the one X39 the following month on auto ship. That gives you time to try your kit, see what you like Dr. Patty. She's kind of mixing and matching. She's probably set her auto ship. She probably switches it around now. And you all get your own website and your own password so you can be in control of your order. So once again, get with the person who brought you here and they can help you. If you don't know who brought you here or you're confused, you can call Jan Rand or email her. I believe her number's in chat. She helps everyone. So you would just say, my friend Becky told me about it. How do I order it? And Jan will make sure the right person gets the right credit. And her job, honestly, for this team, are you ready, is just to be of service. So she can do that for everyone if you need her. Okay, so Jan, I hope your name and number's in chat. Now for practitioners, I do want you to see some of the cool things that I put on our site for your offices. So let's go ahead and take a quick look because Dr. Patty wanted to make sure that practitioners know how to set up their offices so that they can get what they need to their patients. So you just go to Start X39 Biz, that's startx39biz.com. If you don't know what you're doing, who are you going to call? Jan Rand, she'll help you, or you can email her, and you go to take the order. Everybody with me? Under take the order, we've reorganized these so it's easier. Dr. Patty, this is for you. The practitioner order form is now there, and it has the different protocols. The pain and repair protocol, the detox and brain protocol, the skin care protocol, the sleep protocol, and the hormones and digestion protocol. Then you do 1X39 the following month, and you put the information on the personal and payment. Once you take the order, you put it in your back office, and LifeWave ships for you to your client. And LifeWave actually pays you a thank you check for getting it shipped. Okay. Now, once again, if you take this order and you don't know how to put it in your replicating site, who are you going to call? Jan Rand, and she's going to help you do that. So don't worry about it. That's how the protocol works. Now, I had some other folks that said, well, we're not a doctor and we don't feel comfortable using a practitioner order form. No problem. I created the protocol order form for the non-practitioners, and it's the same form, but it's not practitioner on the labels, but it can be used in the same way. Also, if you want a more generalized form, this is brand new, and this is just our traditional paper order form that we've always used. And it just says $149 retail, $119 to be a customer, or I like the kit, the $299 kit. You can see it highlighted in yellow. One sleeve of X39 or X49 equals 2 sleeves of any supporting patches. And then you can build your own pack. So Dr. Patty, if there's a pack that you want to build separately from the protocol, you could do it right here. And so all your forms are here ready to go for you. Also, the doctors love the one-page all product, which is down here. Once again, here it is. And this is what doctor was talking about, how all the patches work. You could just have a one page that you can hand out to people. I love this very much. We can thank Dr. Wendy for the practitioner intake form. You're going to like this one, Dr. Patty. You haven't seen this one yet. This one talks about a patient, their history, so you can give a better idea of what patches they need. And you can literally take their information on this form as well. So it is the practitioner order form. And this one allows you to say what kit they want to buy. So you could use this as an order form as well. Or you could use, if I was a practitioner, I'd use the practitioner order form, and I would use this form as my intake to take the information about a patient to understand what's the best protocol. And I think you'll like that very much, doctor. The other form, thank you, Wendy, can go to the patients or it can go to distributors. It goes both ways. And it's called the customer distributor welcome letter. And you literally can just send this letter out. Can you mute, Jan, please? I don't know why it won't open. Sorry, I'm having opening issues. Hold on. I don't know why. The Word document. I think I have to make that a PDF. Okay, so this is going to have to change a little bit, which is no problem. We have to make it a PDF. But this form right here basically allows you to do an email to your customers or your distributors saying, here's your back office, here's your ID, here's when your order is going to ship. So you can just fill this out, and this allows your people to be self-sufficient. So I want to thank Wendy for creating this form, and we'll make sure that this goes into a PDF so it opens easier for you. The other form that you'll like is under the Use Resource Library. So everything for practitioners is going to be in tab 9, take the order. And tab 14, use your resource library. Please make sure you write that down. So under your resource library, you would go to the product brochures. And you would find there the health tracker. A lot of practitioners like to use this health tracker. So it gives patients a way that they can track from 1 to 10 how they're doing before and after the patches. You may want to print that out. And a lot of our practitioners also like the benefit flyer. So you can print these out in color. They're already done for you, and you could get an 8x11, and this could be put on your desk. You can also print out the look what it's doing flyer, which really shows how X39 is healing the skin, growing hair, and making the face look so gorgeous. So those are a couple flyers that you can print out yourself for your offices. Now, Jan is also going to be, we got 5,000 of these brochures coming. So this is the brochure, and this is the envelope brochure. And look it's right here. If you can also print these out right now and make colored copies and just have them in your office right now before they come. But basically, look what it does. X39, wear 12 hours on to activate, 12 hours off to repair. The stem cell activation patch is made out of. It activates your stem cells. When you put activated young stem cells on old tissue, you turn the tissue young again. And then we talk about what happens, how your stem cells decrease by the time you're 65, and how you will feel results. Some will, some won't, but everybody gets within 24 hours, 3,000 to 4,000 genes set to a younger, healthier state. And this talks about all the things it helps you with, what people notice. And then this allows you to go to startx39.com to learn more about the product and to learn about the research, patents, and GHK copper peptide. I always, even if I was a doctor, I would explain the technology of X39 and then use the one-page all product patches to explain the plus for the protocol you order them based on the intake form. So it's too much, I think, to go over all the patches at once. So I educate on X39, and then you hear what's going on with your patients. And based on what's going on with them, you will figure out what's the best protocol that's right for them. And then you would pick the protocol based on the take the order, which would be I believe the best order form for practitioners is the protocol order form. So does that make sense? Do you guys all understand as practitioners what tabs you go to? So once again, write this down. Our two websites for practitioners is startx39.com. That explains how X39 works. And then startx39biz.com. And you would go to tab number 9 to print out your different forms, and tab number 14 for some of your brochure and point of sale material resources. Now, the good news is, if you wait for Jan to get her brochure, she will make you colored copies of a set of all of this and send. I told her, I think, to make like 3, 3, and 3, and then it will give you like a little pack, and then you'll have to continue making your own copies. But if you don't want to wait for your pack to come and you want to get started right away, well, the tools are right there for you. So with that, it is 10 o'clock. And I thank you all for coming. Dr. Patty, do you have anything that you want to say before we leave on office setup? Did that all make sense as you're working so much with different practitioners?
Great. And thank you for being so responsive and doing this for us. We really appreciate it, and certainly we'll be using it. And one last thing I tell my patients, and I learned this from you, Marci, and from Karen, every decade of your life, you need to give the patch a month to start doing its repair. And so if you're 30, 3 months, if you're 60, 6 months, and that's the repair stage. And then you can start seeing even more rejuvenation after that point. I love that. Thank you for telling me that.
Dr. Patty, thank you so much for your time today and your knowledge. This has been one of the best calls we've had. We really appreciate it. I hope all you practitioners enjoyed it today, and we will see you next week, Thursday at 9 a.m. Pacific. Bye-bye.
Thank you. Bye-bye.
Thank you. Thank you.